We can go through all your medical complaints. Thank you very much.
No, have you got one?
I can find a few, yeah. It's time for Telemedicine, and Dr. Emeka Okorocha is here. Good to see you this morning.
Good morning.
Hi, good morning.
Can we kick off with, before we get to the questions, looking at prostate cancer, because it's one of those cancers that we're all sort of aware of. Men in particular,
Yeah,
I
of
think,
course.
don't like to talk about it.
Yeah.
And we don't like to think about having a check and
Yeah.
all the rest of it. Where are we? What is the situation in the UK at the moment?
So prostate cancer is the most common cancer affecting men now, and 1 in 6 men, especially over the age of 50, will have symptoms and present with some type of prostate cancer potentially. So at the moment, men don't like going for checkups because of what happens, and people like me,
Is that
doctors.
true, or is that a rumour?
No, it's true.
It's true.
It's
What
true.
do you mean,
And
because of what happens?
Well, it's a
because
finger at the bottom.
Yeah,
I
a
see,
lot of the
right.
time you'll have a rectal exam. We call that a DRE.
I had to ask, didn't I?
Direct rectal exam,
no, that's a fair
where
point.
we will use a finger and examine the prostate to check the size and the regularity of it. However, there are a number of different things you can do, in fact, to find out if you may have prostate cancer. So looking obviously at the family history, looking at the age, and then looking at the background of the patient, and then certain tests such as a PSA, which is prostatic specific antigen test, which is basically a blood test that shows a marker which can increase your chance of having prostate cancer. This is because a lot of the symptoms, the urinary symptoms, such as having blood in the pee or impotence or incontinence, these are very, very vague symptoms, and they often occur to aging men anyway. So they're not directly related and say, okay, you have this symptom and you're likely to have prostate cancer.
Do you think one of the reasons as well that men don't like going to the doctor about this very problem is because they perceive that nothing could be done about it anyway? Or that what can be done isn't something men would particularly like. I mean, I know that a lot of people are worried about having the prostate removed renders you impotent, which isn't always the case, is it?
It's not always the case. And when you look at prostate cancer, there are a number of different treatable methods. As in removing a section of the prostate or a resection of the prostate is just one of the surgical treatments. And that depends on the stage of the cancer, the grade of the cancer, how much it's affected, and whether or not you can do chemo or radiotherapy. There are a number of different treatments for prostate cancer. And it's one of these cancers that when caught early is one of the most treatable cancers with one of the best prognoses. So I urge anyone who is 50 and over to have these regular checks, even if it's just a blood test and examination, as embarrassing as it may be.
And I tell you what, be brave, gents, be brave, because, I mean, women go for smear tests, and that must be as embarrassing for women as this would be for fellas.
But women are always generally more likely to be open and go to their doctor when they have a problem.
Yeah, they don't like it, though.
Men are a little bit more stubborn, especially when they're older than their 50s.
But it is that important.
Yeah, these old boys need to get themselves down to the doctor.
Yeah, get it checked out. I'm not 50 yet, so I haven't had the pleasure, but we shall. My time will
I tell
come.
you something I've had the pleasure of
what's
here,
that?
which is Susan in Wolverhampton. Hi, Susan. She's rung in saying, I'm suffering with a lower back problem and sitting aggravates it. What can I do to ease the pain when I'm sat at my desk? Gosh, I'm there with lower back pain.
Yeah, I think all of us are. A lot of us have had lower back pain. Even myself, sitting at a computer. Because when you're sitting down, your back gets stiff. And this back pain is aggravated by sitting, which is why we advise that even when you're working, if you're working from home or you're working for a chair and desk, at least once or twice a day, you're getting up and doing some sort of movement or some sort of back stretch. Because this isn't going to just affect your lower back, but the whole spine in itself. So you should make sure you're as active as possible, because if not, that stiffness is going to cause you pain.
Is it better off if you see these adverts sometimes for these like kneeling chairs, they call them, where you're actually sort of on your knees?
Some people find them more beneficial. Some people find these standing desks more beneficial because they're not sitting. There are a number of different methods you can use.
Just to move around, really.
Yeah, moving around is the main thing.
Cover.
But even if you're sitting for a long time, sometimes you can't avoid that because that's your job. And then you can have modifications put into your chair with backrests, which can ease some pressure on the spine and make it easier for you. And then another thing, obviously, is the obesity epidemic we have and weight gain, which obviously is going to cause a lot more pressure on your back, even when you're sitting down. So obviously, making sure that your diet, nutrition, your exercise is optimum is going to help your back in the long run as well.
Bill in Blackpool, morning to you, Bill. Hope you're doing all right up there. It was terrible with Dudley, I know, in Blackpool. Storm Dudley. Bill suffers with glaucoma. He takes daily drops, but his eyes always feel tired. Is there anything he can do?
Well, OK, so for those who don't know, glaucoma is an eye condition which is characterized by damage of the optic nerve, the nerve that controls our vision, usually due to an increased pressure in the eye. And normally drops do help this because they can decrease the pressure in the eye, and you're regularly, hopefully, seeing your optician who's measuring the pressure in the eye and can do a few more other tests, eye tests, to look at your vision. However, if your eye is getting more tired, that does worry me, depending on what other symptoms you may have, because it could be indicative of another autoimmune condition called myasthenia gravis, where you can get droopy eyelids and tired eyes, and this is a complete different condition in itself.
So what should Bill do?
So what he should do is, one, see his optician and get his test. That way they can regulate and test the pressure in both the eyes and decide whether or not he's due for drops. And there are other different methods you can try, such as laser surgery, could actually release some of the ducts and release the pressure in the eye. And then there's surgical methods, which your optician can refer you to an ophthalmologist for when you have severe glaucoma that's affecting your vision.
So go and get it checked out properly.
Pretty
Just a very quick one from Amir in Newcastle, who's had a bad cough for a week. Do they need to see the GP?
Well, first of all, they'll probably need a COVID test to make sure that it's not COVID. Like, cough is so ambiguous, and it depends what's associated with the cough. It's not necessarily the duration, but it's the other associated features. So is it a dry cough, like a viral type cough, or is it a productive cough where you're producing a lot of sputum? Because in this case, you may need antibiotics. Sometimes you could even go online on Lloyd's Pharmacy and do a questionnaire which can go through the symptoms you have, and you can have antibiotics sent out. And if these haven't worked, you can then go ahead and see the GP. Obviously, make sure you can exclude COVID first, because that's going to be the first thing that comes to your mind in this day and age. However, if you have symptoms such as coughing up blood or sputum or severe temperature or severe chest pains or palpitations, that's when I advise you go and call 111 and not only see your GP, but sometimes you may even need to come into A&E and see a medical specialist.
OK. Amir, there you go. That's the advice for you. Good advice it is too, Dr. Emeka. Good to see you. You're a picture of health.
Well, so he should be.
Well,
Doctor
I
try to be.
to give you confidence.
Yes, quite right. Really good to see you.
Thank you very much.
Are you in every Friday?
I'm in usually Mondays, Wednesdays, and Fridays.
Good. Well, we'll see you.
Yeah, we'll see you next Friday then. Yeah.
Good stuff.
Forward to it.
Cheers,
We're
for
really
having me,
just
guys.
getting used to this ourselves. Thanks very much indeed.